Hello, I'm Dr. Sowmya from the Department of Gynaecology at Aster CMI Hospital, Bangalore. So today I will just, briefly talk to you about menopause and perimenopause. As you know, we are all living, longer nowadays. So one third of our life is spent in a postmenopausal period. And as you all know, menopause is when all menstrual activities stop, and that's because the ovaries stop functioning. I mean, ovulation stops happening, and estrogen and progesterone, which is the two main female hormones, they decrease considerably in their blood levels. So before menopause occurs, there is essentially a transition period which can last for almost 2 to 7 years before the actual menopause, and that is what we call perimenopause. So the symptoms of menopause actually start in the perimenopausal period. And in modern medicine, now the age of menopause, we call it normal if menopause occurs after 40 years of age. So perimenopause can actually ideally start around 40 to 45, but we've also seen younger women in their late 30s coming with symptoms of perimenopause. And the symptoms of perimenopause is essentially, feeling tired, irritable, irregular cycles, sometimes insomnia, and that is all because of the decreasing levels of estrogen and progesterone. However, though cycles may be irregular, there can be sporadic ovulation. So pregnancy is always, a possibility in during the perimenopausal period. So unless you really get into menopause, pregnancy is always a risk. So if at any point you have, irregular cycles and you have symptoms, please see your doctor and kind of rule out pregnancy. Usually what happens is as you enter menopause, the periods become more irregular, they become scanty, they become less painful. So whenever a woman of perimenopausal age group has increased bleeding with painful periods or intermenstrual bleeding, any irregularity from your normal, it is always better to come see your healthcare provider and rule out other diseases. So always don't sit at home and think, oh, this is perimenopausal, because we've seen a lot of people come in with complications though they've had irregularity, but they have just kind of assumed it to be a part of their perimenopausal period. Then coming to menopause. Menopause is usually a retrospective diagnosis. That means when you don't have periods for 12 consecutive months, we usually assume that you have entered menopause. And in menopause, what happens is all the symptoms kind of get aggravated. There are bad hot flushes, night sweats, people find it very difficult to sleep, very irritable, and sometimes what happens is these are normal side effects, but sometimes what happens is there are other health concerning side effects, like your bones become weak, what we call osteoporosis, which kind of so you tend to get fractures easily. You have cardiac events, MI, strokes, because the protective help that estrogen was giving, now that the estrogen has gone, our incidence of cardiovascular problems also increase. Usually we do not give hormone replacement because hormone replacement therapy has its own risk factors. The hormone replacement itself has been known to cause strokes, myocardial infarctions. So unless the symptoms are really life threatening or really concerning and affecting your quality of life, we don't usually give hormone replacement. But I would advise that every postmenopausal woman, if you are not able to manage your symptoms, please come and see us as Aster CMI. We have a dedicated menopause clinic, and we will be able to help you better, because even hormone replacement has to be individualized depending on the patient, her past history, her present medical conditions, and stuff like that. Otherwise, menopause, like menarche, it is inevitable. Everybody has to face it, and with good lifestyle management, we can all kind of go through menopause easily. The other thing I would like to tell you is with osteoporosis. A lot of women we see have taken vitamin D and calcium in the hope that their bones will become stronger. But unless there is a deficiency of calcium or vitamin D, taking those supplements are not going to increase your bone density. Weight bearing exercises, on the other hand, has been really proven to increase bone density. But in spite of exercises, if the bone density decreases, you might need to have special medicines which we give. And menopause also, you should understand, it's a multidisciplinary team. It's not only the gynecologist. We might also need help from the orthopedic surgeon, from the cardiologist, from the physician, because menopause as such will affect the entire body of the woman. And at Aster CMI, we have the whole gamut of expertise. So please come in and let us help you if you have any problems. Thank you.